Hello everyone, let's know more about tuberculosis on the occasion of World TB Day on March 24th. Tuberculosis is a contagious disease which is caused by a bacteria called Mycobacterium tuberculosis. So it primarily affects the lungs, but it can impact any other organ like brain, spine, bone, joint and heart. So how it spreads from one person to another person. When an infected person do coughing or sneezing, it causes release of infected droplets into the surrounding atmosphere. When we inhale that infected droplets, that bacteria enters into your lung and causes tuberculosis infection. So who are all at high risk of developing infection? The persons whose immune system is weak and who are on immunosuppressive medicines for various medical conditions are high risk of developing tuberculosis. Those are having uncontrolled diabetes, who are suffering with chronic kidney disease and HIV or AIDS, and who have been on the anti-cancer medicines are at high risk of developing TB infection. So what are all the symptoms if the patient has tuberculosis? So the lung tuberculosis, most common symptoms are fever and cough, long lasting, most commonly more than 2 weeks of duration, and sputum and blood in the sputum, and loss of weight, loss of appetite and general weakness. And how can we diagnose tuberculosis? Chest X-ray and sputum analysis are the most common investigations to diagnose tuberculosis. And we do drug sensitivity testing also on sputum analysis, so that we'll come to know the sensitivity of the medicines which work on tuberculosis. And usually CT scan and bronchoscopy, bronchial wash analysis and skin test like MON2, quantiferon gold test also plays role in diagnosing of tuberculosis. So what are all the treatment options available for tuberculosis? So most commonly, based on the drug sensitivity test done in the sputum analysis, we select the combination of medicines for certain duration of, it depends on the which organ involved by the tuberculosis. For pulmonary tuberculosis, the duration of TB medicines will be for 6 months, and many patients tolerate the medicines very well, and who have been having liver disease or who are ethanolic, then there are high chances of developing liver toxicity, and we need to modify the medicines in the persons who have been suffering with kidney disease, chronic kidney disease, and whose creatinine levels are high. And how do we prevent the tuberculosis? BCG vaccine helps the kids in preventing developing severe forms of tuberculosis like meningeal tuberculosis and miliary tuberculosis, but it is less effective in adults. So by maintaining good immune system through taking healthy diet and doing regular physical activities and at least 7 to 8 hours of sleep per day, and keeping yourself free and relaxing, by keeping your comorbidities like diabetes under control, you can prevent from developing tuberculosis. Thank you.